CPT JJ-CPV Evaluation and Management E&M Services Guidelines, page 4, part 6.
New and established patient.
This is the difference between a new patient and an established patient, right? Solely for the purposes of distinguishing between new and established patients, professional services are those face-to-face services rendered by physicians who may report evaluation and management services reported by a specific CPT code. And this is just telling you how to find out whether a patient is. Do you have a pen? Here, I'll point out with this.
Okay.
Okay. Okay, here's a pen. Okay, thank you. How to find out whether it's a new patient or an established patient, right? And for this, we have a little decision tree here. For instance, receive any professional services from the same physician or another physician of group of the same specialty within the last 3 years. Okay, have you received a service from the same physician or in the same group? If you say yes, you still have more questions. If you say no, I have not received a service from the physician or the same group, then you are a new patient. If you say yes, there's another question. Was it the same specialty? If you say no, you're a new patient. If you say yes, there's an additional question. Exact same subspecialty. If you say no, you're a new patient. If you say yes, you're an established patient. You see? So you have to follow all these three to find whether it's a new or established patient. Okay, that's our theory for today. Now let's do a problem. 1, 2, 3. Okay, the title of the problem is JJ-RVA. The page is 250, and this is the 26 exercise, right?
Yeah.
And it's a level 2, right? Which is difficult. Difficulty. The level indicates the difficulty, right? And the title is?
And it has 2 codes. This is repair wound.
Repair and wound. Okay. Now the problem reads like this.
Surgery, integumentary system.
Integumentary system, which means mainly the skin, right?
Patient presents to the emergency room with lacerations sustained in an automobile accident.
Okay.
Repairs of the 3.3 centimeter skin laceration of the left leg that involved the fascia.
Right.
2.5 and 3 centimeters lacerations of the left arm involving the fascia. And 2.7 centimeters of the left foot, which required simple sutures, were performed.
Sterile dressing were applied. Okay, now be careful here that to divide the type of lacerations, right? The first type is intermediate because it involves the fascia. So this one plus this one plus this one involve the fascia. You see here, fascia, fascia. So these are intermediate, 3.3, 2.1, and 3.3 centimeters are intermediate. And this one is simple, which means it doesn't involve the fascia. So this one is 2.7. So we have to have 2 codes for that, right? Because one represents the group of intermediates, and the other one, the simple one, right? So, okay, this is the problem. I gave you a little hint because this is a difficult one. And now we're gonna count to 3, so you can pause the video and give us the CPT codes for this this procedure. 1, 2, 3. Okay, the answer is 12034 and 12002, and there's a modifier 59. Did you get that? Well, if you didn't get it, don't worry. This is kind of difficult. It involves a little practice, but we're going to tell you the tips. If you got it, congratulations. I think you're ready for the test already because this is a difficult one. If you got this, you're good. Okay, now let's go to the tips. 1, 2, 3. All right, the first tip.
Level 2 difficulty. There are 2 codes.
Yeah, there are 2 codes here that you have to find. One for the intermediate lacerations and the other one for a simple laceration. And that's why we consider level 2. The tip number 2.
Start with repair wound for both codes.
Yeah, that's the way you start for the intermediate. And for the simple, you start with repair wound, right? Now, 3.
It involves the fascia, then it is intermediate repair.
Yeah, the first code involves the fascia, right?
Right.
Then it's intermediate, repair, right? Then how do you find which one? Because there are several. By the length, by the adding up all the lengths, right, of the wounds. And all the wounds that are intermediate are 3.3, 2.5, and 3 that add up to 8.5, which is graded at 7.5. So there's a code for all lacerations that are 7.5 or more. So you got to choose that one. Now that's the first code. The second code, we need a second code for a simple repair, right? Which doesn't involve the fascia, right?
Yes.
And that's of the foot, right?
Right.
How large is that? Is
2.7
2.7 centimeters. So you have to find one that is 2.7 that is simple, right?
Right.
And one more tip, the second code has a modifier because these are two separate procedures. This is one procedure for the intermediate and another procedure for the simple one, right?
Right.
So that's why you have to add that modifier that indicates that there were two procedures done. Okay, now we have the links to understand the problem, right? What are sutures? What is sterile dressing? What's the fascia? All these, the first 4 are A pluses that we recommend that you watch these, even if you don't have much time, that this will help you understand the problem. And if you have a little more time or you're especially interested in this, you can click on the rest of them, right? But these are not that important, but these 4 are the principal ones, okay? So, and you know the answer already. The answer is 12034 and 12002.59. Now you have everything. Now we're going to count to 3 so you can pause the video and give us the path. How we found the codes, okay? So 1, 2, 3, okay. All right, this is the summary of the whole problem. The problem reads like this. It is a surgery, the integumentary system. The patient presents to the emergency room with lacerations sustained in an automobile accident. The repairs of the 3.3 centimeters skin laceration of the left leg that involve the fascia, that's 1. 2.5 and 3 centimeters laceration of the left arm involving the fascia, those are 3. And 2.7 centimeters of the left foot, which doesn't involve the fascia because it doesn't tell you, but which requires simple sutures, were performed. The sterile dressing were applied. Okay, that's the procedures, right? Now, the first code, the main words are repair and wound, right?
Right.
All right. So, the code number 1 through the index is found like this.
Okay. First you go to index.
Then you go to
Repair.
and then you go to wound, and then you have to choose simple, intermediate, or complex. Why is intermediate? Because it involves the subcutaneous tissues, which is involves the fascia, right?
Right.
So that's why we choose intermediate. So we get a range of codes: 13031 through 12031 through 12057, right? Now we're going to go to the tabular to find which one it is, and that is by the sum of the lengths of the injuries, or of the lacerations, right? So we start with the first one. What is the first one? 1231. What is that?
First we go to tabular, then we go to 1231. And that's repair intermediate wound scalp of axially,
trunk, or extremities. In our case, it's extremities, right? 2.5 centimeters or less. But in our case, we have to add them all up, so it's like 8.8. So this is not it. Right. Keep going.
And we go to 12032,
which is
2.6 centimeters to 7.5 centimeters.
Which is still not. We are 8.8, right? What about the next one? 12034, 7.6 centimeters to 12.5 centimeters. This is our baby, right? Because it's 8.8, the sum of all our lacerations. So it's more than 7.6. So this is our code. So we go back.
Well, first we go on and on over the 57.
Right. You can continue with the other ones, but now you know that you have to go back to?
We have to go back to 12034.
Because 8.8 is within this range, right? So that's why we found the first code, right?
Right.
But now we need a second code for the simple repair of the left foot, right?
Right.
So we're going to go down for the second code. We start again with repair and wound, but this time it's simple, right? So the code number 2 through the index is found like this.
First you go to the index.
Go to the index.
Then you go to repair.
Go to repair.
Then you go to wound.
Wound. And now it's? Simple, right? And there is a range of codes right there, right?
Right.
Okay, now we're going to choose that from the tabular. So the code number 2 through the tabular is?
First you go to tabular.
Tabular.
Then you go to 12001.
Uh-huh.
Simple repair of superficial wounds of scalp, neck, axilla, external genitalia, trunk, and our
Our extremities, in our case, extremity is 2.5 centimeters or less, right?
Right.
Is that our code?
No,
because we have 2.7, right? And 2.7 is greater than 2.5. So let's try the next one.
Okay, 12002, 2.6 centimeters to 7.5 centimeters.
That's our baby. It's 2.7, right?
Right.
That's the right code. So here, just try the next one, just for kicks to see.
12004 is 7.6 centimeters to 12.5 centimeters.
Which is too big, right?
Right.
So there is even more, but we're just going to ignore them. But we have to go back to, this means go back to 12002, right? Which is our code. So we found our second code. So we have the second code here. Now, these were two different procedures, right?
Right.
One is an intermediate. The other one is a simple one. So two procedures done in the same operation, in the same instance, in the same time. So we have to put a modifier.
Right.
Well, what is the modifier? That this one here was a different procedure. It indicates a different procedure, right? The second one was a different procedure. That's what it needs, the code 59, which is distinct procedural service, right?
Right.
It's not another intermediate. It is a simple one, which the way to repair it is different. That's why we need a 59. Okay, so that's our answer. That's a whole problem. Thanks for watching, and don't forget to visit our website, and also
you can subscribe to us in YouTube right here.
All right.
By clicking here, this is it, to get our new medical coding videos.
Right, and you will get?
You will get up to 3 videos every day that we make. ICD-10, CPTs. All that is needed to pass the medical coding certification exam.
So don't forget to visit our website and subscribe to our videos. Thank you.
Bye.
Bye.
Bye-bye.